Good morning, good afternoon, and good evening. Welcome to the 476th day of continuous Zoom session of IFPH. Let us start the program with a silent prayer for a minute. Thank you. Today, our chief guest is Dr. Sheeba Bhms, MD Homeopathy, State Convener Sadgamaya. That is a special project by the Department of Homeopathy of Kerala for the betterment of or improving the learning disabilities of the students of Kerala, schools in Kerala. And the medical officer in the government homeopathy dispensary, Narangana Padamrita, Kerala. The topic for presentation is skin conditions and homeopathy part 2. I have already heard hello from Dr. Sheeba, well electrifying topics and nice presentation, wonderful presentation. I'm expecting again once again from Dr. Sheeba. As a platform is yours, you can continue for next 40 minutes.
Thank you, sir. I hope I'm audible.
Yes, yes.
Okay. So, good evening. Sorry. So, our topic is, of course, dermatology. Last time we were discussing bacterial infections or pyodermas. We discussed all the pyodermas and we were dealing with the medicines, which I just slipped off within a few medicines. We didn't get much time. So this time I'm not continuing with medicines alone because I think it will be a little bit boring. So I'm taking a new topic, and how up to half a time I'll be discussing the condition, and after that again we'll be discussing the drug. And as usual, we won't be reaching anywhere. We can do it in further classes if there is time. Okay. So please let me go on with my today's presentation. That is fungal infections. Okay, last time we were dealing with bacterial infections. This is something about fungal infections. Then we have to deal with viral infections, and after completing all viral infections comes the other sort of skin complaints which we were asking for, like autoimmune conditions and all. We don't know how much we'll be reaching, so let me please start with fungal infections. We go through this picture alone and we get all the skin conditions caused by fungus in our body, that is dermatophytosis or ringworm. So most common fungal infections of the skin caused by microsporum, trichophyton and epidermatophyton. These are it, beginning from what tinea capitis. That you can go through the figure. If I go through, there will be lacking of time. But remember that tinea capitis comes from the scalp. I'll be discussing it short. Tinea faciae, tinea barbae, tinea corporis, tinea unguum, tinea incognita. Like that, it goes the whole body. I'll just mention the most important ones. So this is tinea capitis. Okay, a common condition in our OP that we are facing, which occurs mostly in the scalp of children, especially localized form of partial alopecia. You know, there can be a lot of cases where you can lose hair. Okay, it can be through an infection, it can be through hereditary conditions of alopecia. But in case of children, where there is localized form of partial alopecia with intense itching, erythema, and scaling, remember that it can be a case of fungal infection, tinea capitis. Sometimes you may get a boggy swelling on the scalp. Okay, which is, we usually call it as a case of carry-on. Then in both cases, how will you identify what kind of infection it is? So just go through the nature of the hair, how the hair looks. Okay, hair in the follicle will be very dry, lusterless, and broken at various lengths. That's one typical example of a feature of tinea capitis. And in another variety, you'll be seeing something called black dot tinea capitis. You know how it happens? I said like hair can be broken in two ways, right? One, the hair in the follicle is dry, lusterless, and broken at various lengths. And in another variety, the hair will be broken at the level of skin surface, producing pictures of like that of black dots. If you see the surface of the infection, you'll be seeing some black dots because the hair is what torn up from that part. Okay, that is also a case of tinea capitis, and that area of alopecia is called black dot tinea capitis. Okay. I think there is some disturbance
Yes.
going on. Um, can I continue? Is there any?
Oh, yes, yes, no problem, no problem. Somebody is
Okay, that's
unknowingly,
fine.
unknowingly thought.
So this is okay, sir. This is a case of tinea capitis. Okay, and what is this? This is a case of tinea barbae. Conditions which we I think I was going on mute for a while. So tinea barbae, which involves coarse hair of beard and moustache, red inflammatory pustules with exudation and crusting. Okay. Now I'm just completing it, and after that we can go to the drugs. Tinea corporis. Okay, this is a case which requires what skill to clear, because tinea is a redundant infection. We may think that it is a very superficial thing. We can clear it very easily because most of the systems fail here. What railingly the reason is that this is a very spreading and redundant clinging thing. Okay, this happens in trunk and extremities. Tinea corporis, severely itchy, circular or irregular lesions. Remember that always it may not be circular, but there will be a pattern for it. Severely itchy, circular or irregular lesions with well-defined active borders. Last time we discussed about pyodermas, we discussed about erysipelas and cellulitis, where we are having active borders and not. Here also you have got irregular lesions or circular lesions with well-defined active borders with papillovesicles, but central part shows erythema, scaling and hyperpigmentation. Okay, that is a case of tinea corporis. And what is this? This is tinea cruris. Most of the patients complaints, they get tormented by their skin when they get complaints like this, because that much severe itch it produces, especially in the groin area. Whenever we see such patients, we often go through the kind of dress they are wearing and the kind of hygiene they're having and the kind of deficiencies they're having. That's very important. So tinea cruris in groin. In adults wearing clothes made of synthetic materials like nylon, which can accumulate heat and humidity. So this is the importance of your advice over generally how to clear such a case other than your medicines. Okay, then this is a case of tinea facial. Infect skin of face excluding moustache and beard. That's the peculiarity. Okay, it won't be affecting your moustache and beard. It will be affecting the skin of the face, infecting the skin of the face except those parts. When topical applications alter the appearance of the lesion, it is called tinea incognito. So what happens in this case? You will be getting an elevated surface here, and after a time you will be getting some crusty kind of lesions here. And if you are a hasty prescriber, I have seen people written diagnosed the case diagnosed as psoriasis even in such cases of tinea, lasting case of tinea, because when the infection is redundant and it goes on, its appearance changes. So you have to see the history. Okay, you have to see how frequently it has occurred and how clinging the infection is. So this is just an infection. Whenever you see an erythematous surface which is elevated and which is having some scaly lesion, don't get confused with psoriasis or seborrheic dermatitis. This can be a case of tinea faciae, that is tinea infection itself with the characteristic severe itch it will be presenting. There are many other symptoms for the other conditions which I mentioned to diagnose it. Then this is a case of tinea manum, which is found in palms. You get a lot of medicines. Okay, this is a sure case of homeopathy. This is tinea pedis, that is infection of soles or toes. So common in those wearing shoes and nylon socks in summer. Okay, that's a problem with Indians, I think, because there is no dress code for climates actually for us. We'll wear nylon socks in summer. We'll be wearing very hot dresses in summer. Even we wear a tie. Okay, for that, in such cases, we have to, I think, follow foreigners because they never do this. Okay, then under surface of toes showing peeling, maceration, and erythema, and can be a case with or without itching. That is a case of tinea pedis. And this is a case of tinea unguum, that is onychomycosis. Okay, onychomycosis involves nails, especially it involves nail bed. Okay, nail black and brittle. So if you're walking in a little bit village area, okay, or some remote area, you'll be getting a lot of such cases because you'll be dealing mostly with farmers. Okay, people working in the soil, so they are always having this corrugated nails. It involves nail and nail bed, and the nail will be black and brittle. What is this case? This is a case of pityriasis versicolor. Pityriasis versicolor is caused by Malassezia furfur. It is a scaly, hypopigmented macule on upper trunk which spreads to lower trunk. Just see it. This is a common condition we are getting, right? This is pityriasis versicolor. Now, I'm just going through some of the repertory pages where the specific name is given, like barber's itch, ringworm of beard. A lot of medicines are mentioned with the same name, ringworm of beard, barber's itch. Again, ringworm in general. See how many drugs. So I'll be discussing these drugs according to the repertory order itself. Ringworm in general, see how many drugs, and ringworm beard, ringworm face, ringworm head, all the conditions which I mentioned. Okay, all those are getting mentioned in our repertory, not in general, but with a specific name, with all those medicines inside. We have to differentiate. Okay, then tinea in general. See, tinea in general, and trichophytos is the name with ringworm. So all these things are coming under it. So now what I'm going to do is I'm going to discuss, see, just for the sake of discussing something clinical, I went through fungal infection. This time we are going back to the medicines we were discussing. Okay, so please wait for a while before I... So last time we were discussing drugs on pyodermas, that is vesicular lesions, I hope, and we discussed some 2 or 3 drugs. But meanwhile, I was giving some comparisons. Now I'm going back to the same thing, and in future classes, I think if we all get time, we'll be discussing some other drugs too. So here I'm starting from where I stopped last time, and I'm discussing the drug called dulcamara. So last time we were dealing with impetigos, ecthymas, etc. So this is one drug with eruptions nearly like impetigo. You remember the impetigo lesion which I showed last time? Okay, I hope you'll be remembering that crusty lesion which is superficial. Remember, which produces no scarring, but ecthyma does it, right? Remember it, I hope. So little boil-like eruptions, if you are getting it, this is a very specific thing for that. And also for crusta lactea conditions in scalp, you can think about dulcamara, but that is actually the condition you are getting from the disease. What is so specific for homeopathy in dulcamara? What kind of weather brings such a condition to a patient when you are prescribing dulcamara? Of course, it is ailments from damp weather, especially cold. You know, that is a very specific symptom for dulcamara, because you know many medicines like what natrum sulf, dulcamara, a lot of things. If I mention, it won't be ending. Having the specific ailments from damp weather and cold aggravation. And also you can remember that typical cases, Ken has given one particular thing called eczema of infant. Okay, so that is actually a specific action, eczema of infants, where a children few weeks old, okay, very small children with eruptions on cheek covered with crust. Okay, remember how many cases has gone through your hands with the same condition. Little children, perhaps some 1 month, 2 month age, or a little bit more younger, they will be having what eruptions on the cheek. They will be having eruptions on cheek which is covered with crust. You try many drugs, okay, you can't get a constitutional drug over a small kid, so you try all the medicines coming randomly in your mind, but that is one specific drug, dulcamara. Okay, if you have so sure, you won't be getting an ailments from damp weather, cold there, because it is a very small infant. You are not supposed to get all those symptoms from such a small age. He or she has just arrived. Okay, but still, if you find such a symptom, it's almost a specific action for dulcamara. See, this is actually given in the text and practiced. Eczema of infants with what eruption on the cheek covered with crust. Remember that this matches exactly the condition of impetigo which I mentioned. That means it is almost a specific for that. Okay, how many drugs you will get other than that? Of course, you can get your sepia there, graphitis will be there, petroleum, calcarea, arsal, all these symptoms will be covering. But this typical infant with such a symptom, give a dose of dulcamara, very mild dose, to see if it works. Okay, perhaps for sure it will. So pruritus was cold and wet weather. That's in the case of an adult case for it. And remember that because we are dealing with vesicular lesions like bacterial infections, pemphigus is one important thing covered by dulcamara. Pemphigus, then what kind of what dulcamara has? We all have studied in our medical classes. What's on the palmar surface of hands and urticaria, which is aggravated by cold, and the characteristic kind of, remember, vesicular eruption. We are dealing with vesicular eruptions, and dulcamara is a specific for impetigo and including crusta lactea in scalp, where perhaps if you are a hasty prescriber and if you are not getting time, a rash prescription even will do wonders with dulcamara. So that's about dulcamara. I go unmute often. I don't know why. So let me discuss one very important drug. Okay, in our Medica for all these kind of eruptions. Don't think that why I am not mentioning sulfur, sorinum, all those characteristic drugs first, because I am just going in the order of repertory. Because otherwise there won't be any order for it. Okay, so graphitis. Whenever you remember the term graphitis, one word comes to your mind. What pulsatilla is at puberty? That graphitis is at menopause. Okay. Of course, when you find an obese lady, okay, this is a characteristic thing. An obese lady constipated with a scanty menses, having what eruptions with rawness and excoriation, which is happening in the bends of joints. That is a specific case of graphitis. Okay, you know, lot of drugs can come for tendency to eruptions on bends of joints, but this is actually an important thing where you are finding, you know, in calcarea carb, even Vidalkas and Kent and even Hanuman says you find an old person with an edematous knee joint, which is who is having an aggravation from cold, okay, who used to sweat a lot, it may not be there in the second or third stage. You immediately think about calcarea carb. Just the same way, if you find an obese lady who is having constipation and having scanty menses and who is having eruptions with rawness and excoriation on the bends of the joints, like your elbows, beneath your breasts, okay, like your ankles, anywhere, you get a case of graphitis there. Bends of joints, this is very typical. What I have to mention in graphitis about pyodermas is this eradicates the tendency to erysipelas, which is a very golden symptom. You know, erysipelas happens, okay, you can give a lot of medicines for erysipelas, but there are persons who are having very sensitive type of skin who gets erysipelas very easily. So if you want to eradicate that tendency, this is a specific word given in graphitis, eradicates the tendency to erysipelas. So you'll be getting that persistent dryness of the skin here, as in case of sulfur. Then unhealthy skin, every injury separates, will be there. What about the kind of fluid that exuding from it? Of course, there will be oozing of sticky exudation from the eruptions of graphitis. Then tendency to skin affections and constipation of a stout lady. What about its aversions and what about its cravings? See, two golden things. Aversion meat will be there. Aversion sugar will be there. How will you know whether the patient is having an aversion to meat or aversion to sweet? So one time I prescribed a case of graphitis just because she said a typical word. Whenever I see something sweet, I feel like I want to vomit. It nauseates me. A characteristic aversion towards sweet. Okay, the person can't even tolerate the idea of putting sugar in her tea. If it is put, she won't take the tea because it makes her nauseous. That's a kind of aversion to sweet. How many of us have it? We say we have aversion to sweet, but that's not the characteristic aversion. You have to grade the symptom. What is it? Aversion to meat. I don't like meat, but if I am having a nausea from even the sight or smell of the meat, I am just horrible with it. That's a case of characteristic aversion. If you get it, give it 3 marks. And it may lead us, if you have the characteristic aversions, may lead us to a graphitis skin symptom. So always remember that we are not prescribing for the kind of skin the person is having. We are prescribing for the person. We are never prescribing for erysipelas or impetigo. We are prescribing for the person to get eradicated with all the kind of symptoms he is having. That is a glory of homeopathy. Homeopathy never clears his skin alone, it clears him of his troubles. So that's what we wish, and that is a case of graphitis. You know, graphitis can be used especially excoriation between thighs. You will be getting two specifics there, sulfur and lyco, which we randomly prescribe for excoriation between thighs. Remember that if you are getting the kind of person I mentioned, obese lady, constipated, menses candy, that is a 3 mark. You get that graphitis in your mind. Remember where the symptom comes, excoriation between thighs, you can get it. And what is the most common kind of prescription we are giving graphitis for in our OP? Of course, for our nails. Okay, that is nails deformed and cracked. You prescribe graphitis ointment randomly, don't you? And if you are having cracks on soles, graphitis ointment, that's the best way to get loose of the graphitis you are having. And the patient will be asking for that characteristic black kind of ointment you are having, please give it. Even if they don't know the name, they know that that black ointment is working wonders over it. Okay, so this is a specific thing. And also remember that this is actually a great breast medicine. Okay, why it happens? You know, graphitis is the first medicine to be used in almost all breast conditions. It can cure even breast cancer. We have got a lot of medicines like phytolacate goes on and on, but the medicine for most important in breast conditions, of course, comes for graphitis. And also you can give it in case of fissures on end of fingers, nipples and vulva. That's one thing. And fissures of anus too. where you will be getting, I know the random prescriptions will be, of course, you'll be prescribing Retania, Peonia, all those things. Remember, graphitis is one major thing where you can cure such a complaint. So that was about graphitis. Okay, now I am discussing nitric acid. Okay, so why do I discuss nitric acid in bacterial infections? Because most specific kind of infections, symptoms that we measure in nitric acid is its pace. Okay, mucocutaneous junctions. Whenever you remember something and a lesion coming at an area of mucocutaneous junction, you think about nitric acid. What kind of pain a nitric acid patient will get? It's a splinter-like pain. Okay, it's a splinter-like pain. And what kind of edges the lesion will be having? Always remember that it's a zigzag irregular edge. When you are getting a typical round lesion, which is having specified border, that's not a case of nitric acid. It will never give you such an ulcer. An ulcer which is gone, zigzag irregular edges with its base like raw flesh. What did I mention in Merksol? The kind of what ulcer Merksol is protruding will always be having a white lardaceous base. There can be cases other than that, but a white lardaceous base always makes us think about Merksol. Just like that, if you find a lesion which is having zigzag irregular edges, you are treating a lot of kind of ulcers, right? Zigzag irregular edges with base like raw flesh, and you will be getting something like exuberant granulations towards the lesion. That can be a very important case of nitric acid. And in case of nitric acid, the skin complaints doesn't matter alone. You can get the patient immediately when it is a nitric acid, because this is a very strong constitutional tendency a patient is giving, a vibe you will be getting from a patient. What kind of person will be a nitric acid patient? So I think the kind of person who has been mentioned as pest in Veterinaria Medica, PESTS, pest. The persons who are appearing to yourself as pests, that's a particular case of nitric acid. That is a constant irritation or dissatisfaction being provided by the patient. We go through many kind of patients. Okay, we get a fragile pulsatilla, we get a bald like a reserved natrum. Just the same way, you get some persons who are irritable. Okay, they irritate, and when they are in front, you are not the same doctor you are. You get a vibe like you are getting irritated, and the same irritation is getting spread. That kind of pest-like action always comes from a nitric acid patient. Never pleased. You have seen old persons coming in front of you, they will never be pleased. You smile at them, they won't smile back. Okay, they don't care. So never pleased, even under the most joyful circumstances. Unfit for company, that's a word for it. See, I'm discussing skin lesions, but I'm telling you the characteristic continuing eruptions will always need a constitutional drug, where you get this zigzag kind of eruption with the base like raw flesh ulcer, and you get the kind of person which I am mentioning. That's a sure case of nitric acid. You'll cure it within a week or two. That's the importance of constitutional symptom. So what makes the patient having this kind of eruptions? Of course, there will be a sluggishness of circulation. Okay, extreme weakness and chilliness, as in any other acid group, he or she will be presenting. And the most important thing is offensiveness. Like that's an offensive patient. Offensive perspiration of feet and urine smells like that. Of course, common things which we have studied in our Veterinaria Medica. What about the anxiety of health the patient will be presenting? Many anxiety drugs. Okay, the anxiety of herself, who clings with maximum weight on you, who will be exaggerating all her symptoms, that you'll be knowing. What kind of anxiety nitric acid is presenting? Extreme anxiety over health and fear of death. Okay, becomes a constant torment. Okay, we won't get that order from feet or desire for fat and salts, which we usually mention. I'm not going through all the symptoms of nitric acid. Physical symptoms may disappear in a last stage, but remember that these things will be there: anxiety over health and fear of death. And of course, there will be complaining nature. Always complain. Whatever you do, they will never be pleased. Whatever you do, they will not be happy. And one particular thing, unforgiving nature. You just mentioned something in a joke. Okay, you are a doctor. You are telling that you are getting old. That's why your symptoms are getting worse. You didn't mean anything harmful, but you will know the result, because they will never forget it in their life. That's a kind of unforgiving nature. We ourselves meet such people in our friend circle as well as our family, right? Some persons who are unforgiving. You give them a harm and you just say, I'm sorry, I won't repeat it. It was a fault. They say it's okay, but they never forgive. They remember it. Okay. There are persons who get detached from us. Okay. There are persons who never would harm us, but this is a kind of what unforgiving nature, and that is a trouble. And an irritable person who is sensitive inside and outside, and an insane anxiety over health will also be present. That is, you feel a barrier when the patient is in front. You know, when a phosphorus patient is in front, you are a happy person because he or she will be yielding, he is talking a lot, an exuberant nature. Okay, we are happy. But when a nitric acid patient is in front of your mind, front of your chair, that matters, because the air itself gets what a bad vibe. Okay, and you feel the barrier. You can't crack the case. You can't go through. That's a case of nitric acid. So remember, whenever you get a lesion that is happening in mucocutaneous junction, see what will happen if you're having a lesion in mucocutaneous junction which is actually going malignant. You can prescribe drugs like Contorango. So I have seen persons rapidly prescribing Contorango whenever they are getting a lesion on mucocutaneous junction. Always remember the pace of the medicine as well as the pace of the symptom. Okay, simple prescriptions won't go for deeper medicines like that of Contorango. Okay. Okay, now let me discuss one more drug called petroleum. Okay, that is one important drug we are having in our biobacterial infections as well. Skin dry, rough, cracked and leathery. Of course, it will be there. Slightest scratch separates. All medicines, almost all of them have. What is a characteristic nature? How will you prescribe? Aggravation always from winter. If you are having the complaint which is having aggravation always from winter. Okay, remember petroleum. And what psoriasis of hands, intertrigoin crust, that's one portion where petroleum comes. You'll be getting the chill plains, painful itching, chapped hands, aggravation cold weather, which comes under petroleum. But which medicine will be more prominent if there is a sensation as if getting frozen? That's not petroleum. The same complaint, when the patient is mentioning that there's a sensation as if he or she is getting frozen, agaricus is more prominent, right? More prominent than petroleum will be agaricus, especially when tissues thin over bones or back of toes. Back of toes, if you are getting the lesion, that can be a case of agaricus. Okay, so what kind of oozing will be there in petroleum? We discussed graphitis, which is having thick, sticky exudation. Here it will be having an oozing of a thin, watery fluid in case of petroleum. Graphitis, you know, it is more like honey, like sticky viscid fluid in graphitis. In petroleum, it is oozing of thin watery fluid. Then there will be isolated herpetic vesicles. That's a specific case of petroleum. Can you tell which condition you will be making that hasty prescription, seeing the condition that this is a petroleum and I will get a result within 1 week? What kind of lesion petroleum will be producing? As all these things, chill plains, painful itching, all those things will be there. But there is one specific thing, especially about the back of the neck, which we call back acne. Okay, back acne cases, you know, almost all cases, I think I prescribe it randomly, we get a result from petroleum. There are so many drugs having back acne, but isolated herpetic vesicles, especially about the back of the neck, which we call back acne, that's a specific action of petroleum. Then you'll be getting that cracks, ends of fingers and back of hands, ulceration spreads, itches, can't rest until part becomes bloody, that much it itches, right? And also you give it for aphtha with thick yellow discharges later. You'll be knowing that are common symptoms. Then let me discuss one drug called Rus venenatum. Okay, you know what is the characteristic nature of rus tox? I forgot to mention rus tox. What is the characteristic nature of rus tox? Of course, it produces a vesicular lesion. It will be producing a lot of kind of itching and all. But if you find the skin symptoms of skin symptoms more severe than that of rus tox, this can be a case of rus venenatum. Vesicular inflammations everywhere, just like that of rus tox. What is the diagnostic feature of rus venenatum other than rus tox? You know, rus tox will be producing a round vesicle mostly, but just in the case of nitric acid, where I mentioned zigzag eruptions. So there it was not a vesicular eruption, there it was a case of ulcer with a raw fleshy base. Here I am talking about a zigzag eruption, which is vesicular. You'll be getting it in cases like pemphigus and all. You won't be getting the round lesion, but it will be a zigzag vesicular fluid-filled lesion. That's a case of rus venenatum. So erysipelas with skin dark red and all, there will be face swollen, all those symptoms will be there. But remember that zigzag nature is specific for rus venenatum. And I think you are getting bored a bit because we are continuously discussing what drugs. But okay, let me tell you one story of McKenna's gold. Will you be hearing me? Okay, for 1 or 2 minutes so that you get outside the boring nature. in homeopathy, you are not prescribing for the condition, you are prescribing for the person. That's what we usually say. And when we take a case, we need a lot of symptoms. We call it constitutional prescription. And when you give a constitutional prescription, you clear the case. So I remember the story of a film called McKenna's Gold being taught to me by the veteran homeopath Dr. Saifuddin. Okay, he is my mentor, the guru. Okay, with whom I started my homeopathy as a house surgeon. So he used to tell me this story of McKenna's gold, you know how it goes. This is about a valley of gold. Okay, there is a valley of gold, and some people are going to get it. Okay, there is one person who is having the map with him. He has burned the map and he is having it in his brain, so that the persons are forcing him to give the idea of the map for them. So they are going to the valley, and their person knows that there's a boulder. There's a great boulder standing in one part of that desert. Okay, and when the sun goes down, what the image of the boulder goes on and on and on, and finally it reaches a point for just a second, and that is the entry of the cave, where you can go through and get the canyon of gold. So just like that, he said, all those symptoms which we collect constitutionally, okay, goes just like the image of that boulder, which makes us join the cave, and that is a key of the drug. And when you open it in a flip, okay, you cure the case. And I have found it many a times useful, because this was golden words given to me, because most of the time we become hasty, we become lazy, but cure never goes for palliation. Cure is cure, and it is happening only in homeopathy. Okay, so let us come back to our eruption medicines. Cicuta, I hope I mentioned cicuta. With what kind of eczema cicuta will be making? Eczema with no itching, right? Eczema with no itching. That's a case of cicuta. Exudation forms into a hard lemon colored crust. Okay. One important thing about cicuta which we forget is suppressed eruptions causing brain disease. Okay, this is an epileptic medicine. So if you suppress the eruptions, it can go for brain and it can act as an epileptic medicine. This is a case of chronic impetigo. Okay, remember that this is not an acute case, but this is a case of chronic impetigo which can be getting cured by cicuta. You know one specific symptom of cicuta which you can apply for? I'll just say a case. See, you may be eating things in a haste most of the time. Suppose you are eating fish. You get a fish bone in your throat. You get a fish bone in your throat. You or somebody in your home. What happens immediately? Will the person ever let you take that bone out? If it is a child, so what will happen? Mostly the person will be running around. They'll be swallowing something. They'll be taking a lot of drinks with it. But the fish bone is stuck, and it comes in a spasm. So whenever somebody is trying to take it out, the patient won't allow because of the spasm. Okay, cicuta has got a wonder action there. You know why? If you give one dose of cicuta, the spasm will stop and the patient will let you take the fish bone out. Try it when you get a chance. Don't swallow a fish bone to get experiment over cicuta, but this can happen because it can reduce the kind of spasm a fish bone like substance or any foreign substance can produce in your throat and reduce the spasm and remove the fish bone. Remember that it's a case of chronic impetigo. Okay. Now let me go with croton tick. You know, croton tick is a drug with intense itching of the skin. But what is happening with the skin? It's so tender. Okay, so what is happening? You can't scratch. It's unable to scratch and ameliorated by gentle rubbing of the part. That is the characteristic symptom of croton tick. Nothing much to say. So it develops an acute eczema over the whole body. That is the case with croton tick. Remember that it is a medicine for sudden diarrhea, you know that. Vesicular eruptions, a characteristic medicine for vesicular eruption is croton tick. Two symptoms to be remembered. Skin so tender, can't scratch, so the patient will be rubbing over the part. If you get such a case, of course it is croton tick. Then what about natrimor? So almost in all cases of eczema with raw red lesions on the edges of the hair, the first medicine which comes to your mind will be mostly natrimor, and you'll be saying that aggravation, eating too much salt, seashore, let it stay. I'll discuss a case. Okay, I had one kid, some 18 years old. He came to me with violent urticaria whenever he went to gym. Okay, so he is actually working out to get a fit body. Whenever he goes to the gym and he exercises over the treadmill or something like that, within 15 minutes he get a whole round urticaria. He can't continue the thing. He comes back. So he came to me with urticaria. So he didn't mention this violent exercise first. He said he had urticaria. It is there when he's not exercising. So just I asked him, when is it? That is when he is walking fast for getting his bus. He's getting the urticaria because he is exercising there. Patient won't be mentioning to you that I am having an urticaria after violent exercise. They will not even mention most of the time. So you have to prop. So he is getting it other than at gym. That is when he is walking fast for his bus, which he hasn't mentioned. So it means he is having an urticaria after violent exercise. You can get a series of medicine for the same thing. Okay, you can prescribe urticarians, you can prescribe sanicula, there will be hepat, calcarea, epis. All these medicines will be covering urticaria even after violent exercise. That's a problem. Urticaria after violent exercise, if you go, you'll get all these medicines. But I prescribe Natromor. You know why? Because I went through McKenna's gold border image. Simple thing is that I just took the case hold. He just started the complaints in his 10 years. After his 10 years, he developed the complaint. And what happened at his 10 years? His parents divorced. He's so affected towards his father. He's not seeing him anymore. Okay, he's living a happy life with his mother. They are rich. They don't have a problem, but he still misses his father a lot. Okay, you know how symptoms can come physically when the person is having something in his mental state. So this is a very obedient, very good looking, very pleasing child. Okay, of 18 years. He is not causing a what you expect in Natromore, that is introversion. Okay, that's not that kind of reserved nature, but he is reserved because he's not giving it easily. You have to ask continuously, like, what's your problem? When is it happening? You know, what kind of a child is Natromore? If I start giving you Natromore cases, we won't go with the skin because this is one important drug we are frequently prescribing in our Sadgama counseling OPs, because you know any kind of missings, okay, any kind of losses can affect terribly on such a patient. You know, I have got one child cured. He got his complaints even when he was a kiddie. The only problem that I could find was that he was changed of the school. Okay, he loved his nursery school. He had a very pleasant teacher there, but he was shifted from the school, which started his deterioration. And most of the time, I have seen that the coming of a second child, okay, sibling rivalry is one thing which can cause you that trouble. So there are a lot of reasons apart from the loss of dear ones, deaths. That's all ultimate that you will actually expect when you see that the person is having a death in the family. He or she is having immediate grief. You will be knowing it. They will be mentioning it. But these are hidden things. The child never knows he has been terribly affected by the loss he had in his kidney state. When he was in LKG, he was shifted from that school. But when you go through the case in detail, okay, without actually making mess of it, okay, getting too much time and getting bored, you can get that symptom. That is Natromor, an important medicine for urticaria after violent exercise. Then you can get all those kind of herpes symptoms there, as well as hang nails, okay, skin around the nails cracked and dry. Remember, graphite is and petroleum, but Natromor is one important drug. Herpes about anus and on the borders of hair. Always mention borders of hair. And if it is to the bends of the knees, I mentioned earlier, graphitis as well as hepat can come there. What about the aggravation of Natromor? It comes from aggravation from 10 or 11 a.m., right? There will be a time, seashore, sun, etc. Amelioration from open air, just like that of epis and pulsatilla. Then cold bathing, going without regular meals. These are all things given in keynote. Okay. What about the hysterical tendency in such drugs? You always think about Natromor as a reserved person who is not having much feelings, won't be showing much feelings, and there will be a barrier. He won't let others come to him because of his previous injury. He is making a wall so that nobody else hurts him more. But there's a hysterical tendency. Okay, most of the children who make tantrums, okay, comes from Natromor personality. You know why? At a time they break. At a time they break. They will be very obedient. They will be showing very good. But when they are reprimanded and when they feel like they are lost, they are damn bad. And the problem is that they can never be consolated. If they start a fit, okay, it is for them to end it. You can never go for it. So with their wall forming nature, remember that this is also there, and we get a lot of persons of Natromor tendency among young girls, okay, especially teenagers who fall in love with bus conductors, auto drivers. This happened with Natromor. That's a peculiar nature of their sensitivity. Okay, they won't show their sentimental attachments much, but when they are having a loss, they will be grieving inside, which will be causing problems for them. That is Natromor. And while discussing vesicular lesions, I think I must discuss creosote. Okay, You know that what kind of a child will be creosote? What is a overall looking, an old looking wrinkled child with itching so violent towards evening as to drive one almost wild. You will get this symptom. As to drive one almost wild. Severe itching so violent towards evening. And which drug will you give with that kind of itching when there is no eruption? That's a case of dolichos, right? Itching without eruption, that is dolichos, but itching so violent towards evening as to drive one almost wild, that is creosote. You get leukorrhea cases often with severe kind of itching. You give sulfur, you give sepia, creosote is one. You'll be getting severe itch over perineal area with a very acrid discharge. Creosote can come. Also, there is small wounds bleeding freely, excoriating, burning, offensive discharge, all these things, you know. I have to mention this drug, that's why. Then what about Arum triphylla? This is a drug especially indicated in children in bacterial infections. You know why? Most of the time, these impetigo eczema cases, sometimes what happens is they pick and bore into the surfaces. When you see a child who is having a lesion in his chin area or in his nose, you can see their hand always in it. Okay, he'll be boring in that part. That part will be much painful for him. There'll be bleeding, but he'll be going on and on boring. You can get Sina there. Okay, Sina is one valuable drug where there is boring into the painful surfaces. The patient will be screaming with pain. Child will be screaming with pain, but he won't keep his hand out from the lesion. That's a case of Arum triphyllum as well as Sina. You can get in both. Okay. One symptom is pick lips until they bleed. They pick their lips until it bleeds. I remember a case prescribed by Dr. AQV. I always mention this case when I discuss Arum triphyllum. That was a case of nail biting. Okay, that was a beautiful case. The case is that the patient bites nail. So many drugs bites nail. But the problem is that biting goes on and on until the nail gets to bleed. Okay, what kind of symptom is that? That's a very particular thing. You bite, you go on, and the surfaces seems to bleed, and you bite and go on. That is a very character symptom. Remember that we don't have to think much when you get such specific symptoms. Prescribe, go on, you get the case. Sometimes you get a smile in your face. Okay, you should not smile at any patient's complaints. You know, that is a complaint. But why you smile? Because you know you have got it. You'll cure it within 2 days, 3 days. I write it, okay, it will be okay within 2 days. Please come back to me and take a photo. So we first take a photo and we wait for the patient to come so that we get another photo. That's a passion in homeopathy. You know what? If you know the thing that it is going to work, you know, constitutional prescription, you can never be so sure about it. Why? You must be so specific. You must be a person having good counseling skills. You must be a person having interactive nature. If you are a very reserved person, you sit somewhere and you try to take constitutional symptoms, it's not going to work. They won't open up with you. So you must have the skill to open up with them so that you can gain all the constitutional symptoms. And you know that all patients, every patient appears as a saint in front of the prescriber. They will never tell you that they have got all those kind of bad characters, what is in their internal dirty instincts. They won't tell you. So to get it, it needs a lot of time. So that type of prescription, of course, it is entirely provoke. It can cause great happiness, but this kind of prescriptions when you are so sure. So let me discuss one case of breast talks which had given me such a happiness. You know, a lady came to me with extreme tenderness of breast. Okay, she was actually feeding her child. She is having a suckling baby at her home. The problem is that whenever the child sucks, she gets excruciating pain over her breast. So what will you prescribe when you get an excruciating pain over the breast when the child is nursing? You have got a large number of drugs. Okay, first drug which I mentioned, the ultimate breast medicine, graphitis, will come. And you have studied that when the pain radiates to uterus, you can give pulsatilla silesia. When the pain radiates to whole body, it's a case of phytolacca. When the pain radiates to back or shoulder, cotton, like that, you have studied so many drugs. So all these things will come to your mind. But there was one golden point, that Mechana's gold. That was that every time the child sucks, she gets a pain. It's a first time aggravation. After that, it is okay. You have to go only through that very characteristic symptom. Single dose of Prestox 200 cured their case. Okay, why I was actually smiling when I got this case? Because I was so sure it will act. So that is a case where you get a modality or any type of specific lesion, a position when you are so sure. This will be cured by me, and homeopathy will be getting the glory and you smile. Okay. So remember that arum trifilum, whenever you get such a case of the patient biting or boring into the bleeding surface and still getting it carried on, it can be a case of arum trifilum. You can of course go for that. Okay. Then,
Okay.
sir, let me discuss one more drug. Is it okay, or are you going to the?
Okay.
Okay.
Yes.
I will discuss one more drug and finish. Okay, I haven't gone through the constitutional drugs yet because I'll be getting a lot of time for that. I'll discuss a whole. So let me
Okay.
discuss one drug, okay, which resembles to rustox to a great extent, with its skin red burning vesicular, okay, and it can produce a kind of vesicle which can give you the happiness when you find it. The thing which I mentioned earlier, you are getting a kind of vesicle which is filled with an yellow fluid in it. What kind of fluid you'll get in rustox? It's mostly watery fluid. Okay, this kind of drug, which is very similar to rustox, will produce a vesicle which is having a very thick yellow fluid inside. Remember, calibike, it's not a vesicle. It's almost an ulcer where you'll be getting a greenish discharge, which when you can draw it into strings or something like that. Typically, it's a case of calibike ulcer. You remember hydrasis, lot of drugs there. Here, what is happening? This is a vesicle. This is not an ulcer. A vesicle which is filled with yellow fluid, and you will get a typical induration below it. How will you see a ring being put into your finger? You'll be getting that round nature there. Okay, so because of the induration, you'll get that typical ring nature, and you'll be having an yellow vesicle over it, which is filled with thick yellow fluid. Okay, and this type of lesion occurs often in herpes zoster. Remember, this is almost a specific case of a drug called clematis erecta. This will work wonders with it. You all have prescribed clematis erecta in skin complaints, but mostly where will you prescribe clematis erecta? Common prescription. It is of course painful orchitis with swelling, right? Painful orchitis with swelling. First medicine comes into your mind. Which one is it? Pulsatilla. Routine prescription. It will definitely make an impact on it. It will make, even if it doesn't cure, it will palliate. The patient will be happy. They will stand with you so that you can find the right one. So painful orchitis with swelling. Routine medicine is pulsatilla, but when it fails and it indurates, it's a case of clematis. That's where we usually use it. Remember the skin symptom of clematis. So skin will be red, burning, vesicular and scabby. It will be terribly itching and will be aggravated by cold water. Clematis is a medicine which is coming frequently in OP, in skin complaints. Clematis erecta. Then aggravation scalp around the occiput. That is very important. You get a lesion around your occiput, which is very characteristic. Case of clematis, no problems with it. And there will be glands which is very hot, painful, swollen. So this is actually an inflammatory medicine. You use it in varicose ulcers, tumors, etc. too. But the kind of lesions we are discussing in clematis, remember that it resembles to rustox a great extent. And with all drugs, croton tick, ranunculus, anacardium, clematis, they all are like rustox, but remember that they all go more deep into the skin than rustox. So how to find out this drug is what I said. Characteristic vesicle, yellow fluid with an induration below, just like that of herpes zoster. You can get a case of clematis erecta there.
Okay.
Sir.
Well, a nice, wonderful presentation. I can say we have witnessed 21 wonders, 21 medicines of homeopathy. I discussed nicely. The time to go for discussion. Those who would like to participate, please go to the participant list and raise your hand.
Did I mention 21 medicines, sir? You counted it, right?
Yes,
Okay.
all these are wonders as far as I am concerned.
Thank you.
21 wonders of homeopathy. Yes. Could you please close the screen sharing?
Sure, sir.
Yes. The time for discussion. Also would like to, yes, Dr. Padran, Dr. Sir, please unmute yourself, sir. Padran, sir. Yes.
Thank you for the wonderful presentation. Presentation was very nice, but it was very hastily presented. So hardly we have to run to catch it.
We do, sir, with the limited time. Okay, we can only discuss it like that. Otherwise, I'll be discussing one drug the whole day. It is there for it. But apart, we are discussing dermatology. That's the topic. We are not discussing a drug.
Observations, skin observations were very nice and interesting and very useful to practitioners for new generation and old generation practitioners also get very good information on this presentation. Thank you for your wonderful presentation. Thank you.
Thank you, sir.
Yes, sir. Yes. Okay. Thank you, sir, for your participation. Now, Dr. Hubert Silva. Yes. Dr. Hubert, please. Unmute yourself. Yes.
Wonderful, wonderful, wonderful. 3 words are there.
Okay, right.
Can you hear me?
Yeah, sure.
Very nice class. I want to ask you one question because xanthomatous like growth around the eyes too much. Yeah, now it is going closing the eyes itself. Is there any medicine for that?
You want a specific for that, sir?
Yeah, no, I am not. I have to refer it whether there is 1 or 2 medicines or many medicines. I cannot do anything. It is growing each and every time. It is growing like xanthomatous like growth all over now around the eyes and what I have to do.
Do you have a picture of it?
Yeah, I have it. I shall send you.
Sure. So first of all, I think we have to diagnose the case, right? It's a kind of xanthomatous lesion. I can understand. We have to understand whether it is having some malignant nature because it is spreading so virally and it is growing so fast, right? And it is not yielding to you, right? You have given medicine, but it's not yielding.
Yeah.
So,
he had a history of he extracted his tooth, and that time he had fallen and blood loss and some head. He is now very much depressed, and he was an eminent person. He was an retired military from he retired from the military, and he was a teacher. He voluntarily retired from he's very adamant in everything. He is very adamant and fixed in his ideas, but I had given Tuja and everything, but you know the normal medicines I used, but nothing working. He's very depressed now. Yeah.
okay.
Now
So
64 years.
Yeah, we must forget the specific here and go for the constitutional drug because we need a lot of time to, of course, get the symptoms. But the only thing which can heal such a case is the constitutional drug. Because if it is not acting with the medicines you have given already, that is your random prescription is failing. Somewhere we have missed something over his constitution. So if it was me, I would have gone through the whole history to find out. So what do you think, sir, his constitutional medicine is? Which one would be the medicine for the person?
Tuja.
Tuja.
Yeah.
Okay. So there will be reasons for you to think that it is Tuja, sir. So we have to actually think if it is Tuja itself. You have to go through what all things made you think of Tuja. Actually, it's not a discussion getting time. Otherwise, we would have discussed the factors which made you think it is Tuja. And we could also discuss the other. We haven't seen the patient. That's a problem. We all haven't seen the patient. Perhaps. Okay, if Tuja is the constitutional drug, it would have acted. That's what I think.
He has neurological problems, cannot walk and everything. That type of a problem here, like a paralysis person.
Okay.
He has to strain everything. He cannot walk properly. His direction, whenever he travel, that direction will be lost, and some support will be there. Should be there. He need.
Okay. Sir, is it a case of a stroke or something?
Maybe, but the doctors cannot identify what is the case. It is not yet to they could not diagnose the case.
Yeah, an adamant person who is very strict, who is having almost stroke symptom, who is having a xanthomatous lesion spreading fastly, who is losing balance. Drugs like causticum can too come. Many drugs. I just mentioned one randomly. I didn't see the case, but if you go through the old symptoms, okay, from the parents, the relatives, perhaps it may help you. There can be many other drugs covering all those. Okay, constitutionally, may not be Tuja alone. So I think, sir, this is a sure case for you. We should discuss the case. Okay.
Yeah.
We have to find out what is going wrong.
Okay.
Yes.
Okay, thank you very much, madam.
Okay. Now, Dr. Hariharan, yes.
Hello.
Yes,
Hello.
audible, please. Okay.
Hello, doctor. Hello.
Yes.
Can you hear me?
Yeah, sure, sir.
Okay. See, first of all, I am congratulating you
Thank you,
that
sir.
your presentation is very nice. And again, I am congratulating your talent. What is that? What is that is, you know, see, you are going through the constitutional drugs. That will give you wonderful actions. In my experience also, it is like that. See, natramur, graphitis, acid nitricum. See, these are all wonderful drugs of curing these skin symptoms. See, can it, have you treated this pemphigus?
Pemphigus, sir. Is it pemphigus?
Okay.
Sure, sir.
Sure, you
Pemphigus.
have treated.
Yeah, sure, sir. We get cases in OP. Okay, not too frequently, but we get cases often. Pemphigus is not that rare for us. It comes.
It to come. Okay. Therefore, how your protocol is, it is like that constitutional.
Not every time, sir. See, I have once cured a case of bullous lesion, which they didn't diagnose at pemphigus, but seems very near to it. I think I just gave a dose of meserium for it. Okay, and there were some major symptoms which made me prescribe that drug. I have written it somewhere. I will discuss it with you. And other times, the medicines which I mentioned here, they comes most in case of pemphigus because they are vesicular lesions. All those medicines I mentioned comes.
Okay. Very good. Very good. Very good. Okay. Congratulating. Congratulating.
Yes. Dr. Anand Jaiswal, are you there? We are missing you for the last couple of days. Right. Dr. Anand Jaiswal.
Good evening, sir.
Yes.
First of all, thank you, ma'am, for giving us such a wonderful session. Ma'am, I want to ask about the case tinea, a patient with tinea corporis, tinea curis. Now he is suffering from paranoia case, ma'am. After cure, they again. Hello, ma'am.
Yeah, I can hear you. Please.
Okay. A lady patient come with me, a tinea corporis and curis. It is around 4 to 5 years case. Now she's come with a frequent fungal infection, or it's a paranoia case, I think.
Okay.
After giving medicine, the paranoia will gone, then again it recur. So how to deal with this severe tinea corporis, tinea curis, tinea unguinum?
Okay. The problem is I didn't mention medicines of fungal infection here, sir. Okay, I was just dealing with the last pyoderma cases which I was presenting last time. Okay, all these cases comes under medicines for fungal infection, which I'll do in future. But for the time being, I think there are a lot of medicines, okay, having specific action on tinea. But as I mentioned, constitutional drug alone helps you clear it out. Okay, medicines like tellurium can give you wonderful results. Urtica urens, all those things will be giving results for you. Sepia in higher potencies can make wonders. Okay, many drugs for this specific condition. But if you want to completely cure it, I had one case of severe tinea cruris in a child which was cured with tuberculinum. Okay, tuberculinum of course covers the case of tinea, but the constitution made me prescribe tuberculinum, which made the person cleared of it because it was typically a tubercular tendency patient, tubercular constitution patient. That is it. While we are discussing medicines for fungal infection next time, okay, I will be discussing all those medicines coming under tinea cruris, tinea ungum, and your nail infection too. Okay, graphitis is one important medicine covering all the symptoms. We'll discuss it, sir.
Okay. Thank you, ma'am. Thank you.
Yes. Please participate in our program regularly, Dr. Anand Jaiswal. Okay. Yes. Thank you. So now it's time to wind up the session. I'm inviting Abdul Salam sir, please. A lot of thanks. Abdul Salam sir, are you there? Abdul Salam sir, please. A lot of thanks. So he's not responding. Another person, Masrina, yes, please. Please unmute yourself.
Yeah.
Yes.
Hello.
Yeah.
Hi. Can you hear me? Am I audible?
Yes, of course.
Sure, ma'am. You're audible.
Can you see me? No.
No.
I want to start my video. All right. Okay. First of all, thank you so much for the wonderful session. I'm Mazrina from Kuala Lumpur, Malaysia.
Good.
I have a question for you actually, because I really appreciate your vast experience in treating skin diseases. So This patient is 25 years old. He has been developing the skin problem over the past 3 or 4 months, just because he has broken with his girlfriend, and suddenly the eruption came up, a lot of it. And if I can share with you the picture, I don't know whether you can see. Oh, is it? Can you see the?
It's not clear, ma'am. That's trouble.
Oh, it's not
But
clear, is it?
it's a kind of lesion, and you said a history, like he actually broke up with his affair and he got the trouble, right?
Sorry, ma'am.
Yeah, no, please continue. So, what did you do over the case?
Okay, so just started to treat the person with a graphite, but I presume the underlying reason is because of the sadness, because of what happened, and it erupted very severely and a lot of intense itchiness. So what would you advise, to treat such cases based on your
Have you
experience?
prescribed something, ma'am? Have you prescribed? Have you prescribed in that case?
Yes, yeah.
Which drug?
I'm not giving graphite, but I intend to give Ignatia, because that Ignatia and Netumio, because of the of the broken relationship.
Okay.
Is that are you along those lines as well?
Sure, ma'am. But if it is a chronic condition and if it is lasting for a great time, I think we may step on to something more deep than ignatia. I think maybe it can be a case of Staphylococcus aureus. It can be a case of natrum more. It can go deep. Okay. And if it is a severe depression you are mentioning, I may even go for acid force. Okay. So if you are going through the constitutional symptom, it must be the grade of the symptom. As I said, aversion to meat. Just like you want to nauseate, that is aversion to meat. 3 mark. Okay. Just the same way you are telling depression, I am not telling getting what kind of depression he is having. Is he just depressed, or he is so depressed, or he is gone? Okay, all these depends, right? So I think ignatia is a very good choice, but if it is a recurrent and deep condition, you can go on to even sepia can come there after a while, after natrum work. Okay.
All right.
thank you,
What
Ms. Serena.
potency?
Yes.
What potency? At what potency would you suggest? 30 or 200?
Okay, that depends upon the sensitivity, right? Okay, well, depends upon the sensitivity of the patient. I would have started with what in this case, if I was going so sure with the mental symptoms, I would have gone for higher potencies. If it was not, I would have gone for a Siroba 3 or something like that.
Yeah. All right. Thank you so much. Thank you for your advice.
Okay, thank you for participating now. Dr. Dhanesh, yes. Please ask Dr. Dhanesh, and you can say the order of things also to conclude the session. Dhanesh, yes.
Good evening, also. Very good presentation once again. Dr. Sheeba Rajkumar is something just like we have seen a 2020 game, but it is a 21-21 game. That is something different. Actually, we got the extract from each medicine, how to choose medicine, how to differentiate between medicines, and particularly the one thing even if you have mentioned about Sicut, I still remember the eczema without itching. That is something that to be noted. Those are the minor symptoms, but that is the major symptom as far as the remedy is concerned. So this is something that we get rarely in life to have such a session, and I think there will be more sessions on this that will definitely motivate us to practice homeopathy in a better way, and this is what we are looking for. And thank you, Dr. Sheeba Rajkumar, for an excellent presentation once again, and hope this will continue in the coming days also. Thank you all for asking questions and participating in the discussion. And thank you, Dr. Manoj, for your excellent moderation. Thank you.
Okay. Well, that's the end of today's session. We'll be back again tomorrow with other session in English. Trying to wind up the session. Those who would like to participate can continue, others can leave. Be back again tomorrow. So, Dr. Dhanesh for Malayalam session. Thank you.
Thank you, sir.
Thank you, Dr. Manoj and Dr. Sheeba, and all participants. Namaskaram.